Welcome back to Pharmacy Made Easy. Are you feeling anxious about the performance in the bed? You're not alone. Erectile dysfunction or ED affects over 30 million people worldwide, yet it is still surrounded by the silence and stigma. But what if this common issue is actually trying to tell you something deeper about your health? In this video, we will uncover what ED really means, from the causes and the risk factors to the treatment options and expert advice. Whether you're facing it yourself or supporting someone who, it's time to talk openly and confidently. Let's begin. Erectile dysfunction ED is the consistent inability to attain or maintain a sufficient rigid penile erection for the sexual performance. More than half of the men aged 40 to 70 years experience erectile dysfunction, and its incidence is age-related. Normal male erection is a neurovascular event relying on intact autonomic and the somatic nerves applied to the penis, smooth and striated musculatures of the corpora cavernosa and pelvic floor, and the arterial blood flow supplied by the pudendal arteries. Erection is caused and maintained by an increase in the arterial flow, active relaxation of the smooth muscles within the sinusoids of the corpora cavernosa of the penis, and an increase in the venous resistance. Contraction of the bulbocavernosal and ischiocavernosal muscles results in the further rigidity of the penis, with intracavernosal pressure exceeding the systolic blood pressure. Nitric oxide is a key neurotransmitter that initiates and sustains the erections. However, other molecules contribute, including acetylcholine, prostaglandins, and the vasoactive intestinal peptide. Male sexual dysfunction may be manifested in a variety of the ways, and a patient history is critical to the proper classification and a treatment. A loss of libido may indicate androgen deficiency. A loss of erections may result from the arterial, venous, neurogenic, hormonal, and psychogenic causes. Concurrent medical problems may damage one or the more of these mechanisms. Endothelial dysfunction is the decreased bioavailability of the nitric acid with subsequent impairment of arterial vasodilation. Erectile dysfunction may be an early manifestation of endothelial dysfunction, which precedes more severe atherosclerotic cardiovascular disease. Medications, especially antihypertensives, antidepressants, and the opioid agents, are associated with an erectile dysfunction. Let me put it very simple. The most common cause of erectile dysfunction is reduced blood flow to the penis. This can be common in the patients with the cardiovascular diseases such as hypertension and atherosclerosis, and the conditions that cause the neuropathy such as diabetes. Since these arteries supplying blood to the penis are smaller than those supplying blood to the heart, they can become restricted sooner than the larger vessels. Erectile dysfunction can be considered an early warning indicator of cardiovascular diseases, and the males with the ED who has the cardiovascular disease risk factor should be referred to the cardiovascular evaluation. Psychological issues, including the depression and the stress, and the neurological illness like spinal cord injury, stroke, can be contributory factors. The medication used for the other conditions, including the blood pressure lowering medication used in the cardiovascular disease, can contribute to the erectile dysfunction. The key drugs include alcohol, antidepressants like SSRIs and SNRIs. They may decrease the libido, and antihypertensives like beta blockers, clonidine and thiazide diuretic, and the antipsychotics, mainly the first generation one, chlorpromazine, and BPH medications like finasteride, dutasteride, and silodosin. Silodosis is known to cause retrograde ejaculation, and the others include anti-cancer drugs, leuprolide, glutamide, and anticholinergic, atomoxetine, digoxin, and cimetidine, ranitidine, and nicotine. And the chronic use of an opioids, especially with the methadone. Now let's briefly cover the physiology behind erection, emission, and ejaculation, a process that's much more than just a blood flow. We are talking about the full body symphony. Your mind, nerves, hormones, blood vessels, and even muscles are all playing a role. It starts with the nervous system. You got three major players. One is sympathetic nerves from the spine at T11 to L2, parasympathetic nerves from the S2 to S4, and the somatic pathway coming from the pudendal nerve, also S2 to S4. To remember who does what, there is this classic med school phrase, point and shoot. Point is parasympathetic, responsible for erection, and the shoot is sympathetic and somatic, responsible for emission and ejaculation. Now here is how it unfolds. When it's a time for an erection, your parasympathetic system kicks in. It releases the nitric oxide, which ramps the up of CGMP, a chemical that tells your smooth muscles in the penis to relax. This opens the arteries, blood rushes in, and the veins get squeezed shut. Boom, you're locked and loaded. Next comes the emission, the pre-game for the ejaculation. Sympathetic nerves trigger secretions from the prostate, seminal vesicles, and the vas deferens, all funneling into the prostatic urethra. Then, when it's a time to shoot, the somatic nervous system joins the party. The bladder neck closes tight, no backward flow is allowed, and the pelvic floor muscles start contracting rhythmically, pushing the semen out into the in controlled bursts. And when it's all over, your body hits the brakes. Sympathetic nerves release norepinephrine and endothelin 1, constricting those arteries, draining the blood, and returning the penis into the resting stage. That's detumescence, the medical term for the reset. Diagnosing erectile dysfunction isn't just about asking if the things are working, it's about understanding why they're not. We start with a full history, and that means everything from the medical conditions to the lifestyle habits and even the psychological stress. Yes, that include the sexual history, medical background, and psychosocial factors like anxiety, depression, or relationship stress. Next in the diagnosis, we use self-assessment tools like International Index for Erectile Function, Sexual Health Inventory for Men, Erectile Dysfunction Intensity Scale, and Erectile Dysfunction Impact Scale. A focused physical exam follows, looking at the vascular health, nerve function, and hormone-related features such as body hair or breast tissue. And next bit in the diagnosis is lab tests. Basic blood work often includes fasting blood glucose, HbA1c, and a cholesterol profile to evaluate the vascular risks. Additional tests may include testosterone levels, prolactin, luteinizing hormone, TSH, and CBC, and urine analysis depending upon the case. Specialized tests like nocturnal penile tenesmus monitoring are rarely needed, but if there is a history of pelvic trauma, vascular imaging or the penile Doppler might be recommended. And don't overlook the mental health side. Performance anxiety or psychosocial factors can play a major role. So psychiatric assessment may be part of the workup. So bottom line in the ED diagnosis is more than a one size fits all approach. It's personalized process combining history, physical evaluation, targeted tests, and when needed psychological evaluation. Now let's see the treatment. Under this, non-drug treatment include lifestyle changes including weight loss, quitting tobacco, and reducing the alcohol intake can improve the erectile dysfunction. Underlying diseases that can contribute to the condition should be properly managed, and any offending agent should be discontinued if possible. Non-drug options that are beneficial in some males are vacuum erection devices, penile implants, and the surgery. So let's see the natural products that are used in the erectile dysfunction. First one is yohimbine, L-arginine, and Pang's ginseng. The natural L-arginine can cause us dizziness, headaches, and flushing. The same side effects are caused by the phosphodiesterase inhibitors, and additive effects should be avoided. Yohimbine is rated as an insufficient evidence to the date. Yohimb causes gastrointestinal side effects, anxiety, and more severe health concerns including the tachycardia and arrhythmias. And ginseng can increase the risk of bleeding. Now that we have covered how erectile dysfunction is diagnosed, let's move on to what really matters next, the treatment option that can help restore both confidence and the function. And hey, if you are finding this helpful, don't forget to like, share, and subscribe for more clear, no fluff medical breakdowns. Phosphodiesterase inhibitors like sildenafil, vardenafil, Tadalafil, and vardenafil are the first line for the treatment of erectile dysfunction. These are often started at a low dose, then titrated as tolerated, and to decide if treatment success is defined by the patient and the partner. Treatment failure could be due to the number of factors such as lack of sexual stimulation, timing of the dose, and eating a large meal with the dose. Efficacy appears to be similar among the most common PDE5 inhibitors, but patient could consider switching between the drugs if they do not achieve desired effect. If a patient cannot tolerate or has a contraindication to the PDE5 inhibitor, alprostadil can be used instead. Alprostadil is either injected into the penis or inserted into the penis with an urethral suppository. This treatment is invasive, painful, and short-acting. Two of the PDE5 inhibitor used for the erectile dysfunction are indicated for other conditions, and the examples are Tadalafil is used for the benign prostatic hyperplasia at the dose of 5 mg daily, which could treat the concurrent erectile dysfunction, and the sildenafil and the Tadalafil are indicated for pulmonary arterial hypertension PAH, and the patient should not be using two PDE5 inhibitors concurrently due to the risk of additive side effects. Now let's see individual drug classes in detail. starting with the phosphodiesterase type 5 inhibitors. Following a sexual stimulation, there is a local release of nitric oxide, which increases the CGMP and causes the smooth muscle relaxation. These permit blood to flow in and resulting in an erection. PDE5 inhibitors block phosphodiesterase E5 from degrading the CGMP, and the PDE5 inhibitors do not increases the libido, that means a sexual interest, which must be present for a drugs to work. Now, let's see the drugs dosing, safety, side effects, and monitoring. First one is sildenafil, which is branded as an Viagra. On-demand dosing, which means taking the medication only when needed, specifically before anticipated sexual activity, but not taken daily. Start at 50 mg, take approximately 1 hour before sexual activity, and start at 25 mg if you are using an alpha blocker using an CYP3A4 inhibitor or in severe renal or liver diseases. Coming to the next drug, that is vardenafil. It is branded as an Levitra and Staxin. On-demand dosing is 5 to 20 mg daily when required, and start at an 10 mg, take approximately 1 hour before sexual activity. Start with the lower doses of Levitra in select conditions. Coming to the next drug, that is Tadalafil, is branded as an Cialis Adcairca. Cialis is used for the benign prostatic hyperplasia with an ED, and also Adcairca for pulmonary arterial hypertension, and the daily dosing is 2.5 to 5 mg daily. Start at 2.5 mg. Do not use daily dosing with a severe or a renal or liver impairment. On-demand dosing is 5 to 20 mg daily when required. And the bonus tip here is Tadalafil lasts the longest and it is known as an weekend pill. Coming to the dosing of Adcairca is start at 10 mg at least 30 minutes before the sexual activity. Start at 5 mg in the select conditions. And if the creatinine clearance is 30 to 50 ml per minute, use 5 mg when required. And if the creatinine clearance is less than 30 ml per minute, use 5 mg PRN for every 72 hours. Coming to the last well-known drug in this category is vardenafil. On-demand dosing of vardenafil is 50 to 200 mg daily when required. Start at 100 mg, take 15 to 30 minutes before sexual activity, and start the dosing of vardenafil at 50 mg in a select conditions while using the alpha blockers age greater than 65 or using a CYP3A4 inhibitors. In short, typical starting dose are 50 mg of Viagra, 10 mg of Cialis, 10 mg of Levitra, and 100 mg of Stendra. But these dose should be lowered by half if you are above 65 years or old, taking an alpha blocker using an CYP3A4 inhibitors, or if you have a serious kidney or liver diseases. In this case, the dose should be halved. That means 25 mg of Viagra, 5 mg of Cialis or Levitra, and 50 mg of Stendra. Now let's see safety, side effects, or monitoring. Contraindications for this PDE5 inhibitors include: do not use with a nitrate or proisoguat, a guanylate cyclase stimulator. And the warnings are impaired color discrimination, which is dose related, and the patient with a retinitis pigmentosa may have the higher risk, and hearing loss with or without tinnitus or dizziness. And the vision loss rare, but it can be due to non-arteritic anterior ischemic optic neuropathy. And the main risk factors for the vision loss is low cup to disc ratio, CAD, and other vascular condition, or age greater than 50 years. Occasion, ethnicity. Avoid with retinal disorders. And the main other warnings include hypotension due to the vasodilation and high risk with fluid depletion, resting, blood pressure less than 90 by 50 mmHg, or autonomic dysfunction. Pre-abortion, seek emergency medical care if the erection lasts greater than 4 hours. CVD, caution with low or very high BPs or recent cardiac events. If chest pain occurs, seek immediate medical help. And the side effects include headache, flushing, dizziness, dyspepsia, blurred vision, difficulty with color discrimination, increased sensitivity to the light, epistaxis, diarrhea, myalgia, or muscle or back pain, mostly with the Tadalafil. And the main notes include: take it with or without food. Sildenafil and vardenafil can decrease the efficacy if taken with the high fat or a large meal, and this is the common cause of treatment failure as per the guidelines. For erectile dysfunction, no more than 1 dose per day is recommended. Stendra can be taken closest to the sexual activity. And the main drug interactions include: it is an obsolete contraindication to the use of nitrates or rosuvastatin with the PDE5 inhibitors. These combination can cause severe hypotension. These include any prescription nitrates like nitrolingual, pump spray or Bidil or illicit alkyl nitrates. Example, poppers such as amyl nitrate and butyl nitrate. Avoid long-acting nitrates completely. If a patient with an erectile dysfunction has taken an PDE5 inhibitors and developed an angina, short-acting nitroglycerin should not be used until after 12 hours of vardenafil, after 24 hours of sildenafil or vardenafil, and 48 hours for the Tadalafil. Occasionally, if needed, nitrates are used in the acute emergency with a careful monitoring. PDE5 inhibitors can enhance the hypotensive effects of alpha-1 blockers. The patient should be stable on the alpha-1 blocker without excessive dizziness or hypotension before starting the PDE5 inhibitors. If the Cialis is being used to treat the BPH, do not use alpha-1 blockers concurrently. Alcohol can enhance the hypotension with PDE5 inhibitors. Coming to the next treatment option for the erectile dysfunction is alprostadil. This is a prostaglandin E1 analog, a vasodilator that allow blood to flow into the cavernosal arteries, which then enlarges the penis. It is either injected into the penis or pellet is inserted through the urethra. This treatment is invasive, painful, and does not last as long as PDE5 inhibitors do. Alprostadil is used in some men who cannot tolerate or have the contraindication to PDE5 inhibitors. Now let's see how alprostadil is available in their forms. It is available as intracavernosal injection, and this should be reconstituted prior to the use. And the dosing is inject 1.25 to 2.5 micrograms into the base of penis, titrate until desired response is achieved. Appropriate dose should cause erection within 5 to 10 minutes after injection, and that can last for 1 hour approximately. And the maximum of 1 time a day or 3 times a week should be used. Other form of alprostadil available is in the form of urethral pellets. Insert 125 to 250 micrograms of pellet into the urethra. Urinate before administration, maximum 2 times a day, and these should be refrigerated after use. Coming to the safety, side effects, and monitoring parameters of this alprostadil is the conditions that predispose the patient to the priapism. Example, sickle cell anemia, multiple myeloma, or leukemia. And this intracavernosal injection should be contraindicated in the patients with the anatomical deformation or fibrotic conditions such as of the penis or penile implants. And urethral pellets are contraindicated where urethral stretches, balanitis, severe hypospadiasis and curvature, and urethritis and venous thrombosis. The main side effects include penile pain, priapism, headache, dizziness. Intracavernosal injection may cause hematoma, bruising at the injection site, and the urethral pellets may cause the burning or bleeding. Key counseling points of this all PDE5 inhibitors are: take approximately 15 minutes for vardenafil, 30 minutes for tadalafil when taken as needed, or 1 hour sildenafil and vardenafil before sexual activity. Sexual activity can put an extra strain on your heart, so stop sexual activity and get medical help right away if you have chest pain, dizziness, or nausea during the sexual activity. It can cause priapism, orthostasis, and decreased blood pressure. Do not take with the nitrates. They worsen this effect, and they may cause dizziness, headache, flushing, and indigestion. And they may cause ringing in the ears or tinnitus or loss of hearing in one or both ears. And the vision changes including blurry vision and the changes to the looks of color, that is blue color tinge, sudden vision loss, or one in both eyes is rare but serious side effect. Get medical help right away. For the tadalafil, the main counseling point is it can cause us the muscle or a back pain. It usually occurs 12 to 24 hours after taking and can last up to 2 days. To wrap things up, let's quickly talk about the another treatment option, that is the vacuum erection devices or VED. A vacuum erection devices work by creating a vacuum around the penis which draws blood into the erectile tissue known as an corpora cavernosa. Once a firm enough erection is achieved, a small elastic ring is placed at the base of the penis to keep the blood in and maintain the erection. The cylinder is then removed. The best part of this VDE is works regardless of the underlying cause of an erectile dysfunction, whether it is physical or psychological. However, many men find them bit awkward or uncomfortable to use, which is why they tend to be underused. Some may experience mild discomfort, but serious side effects are rare. Still, for those who can adapt, it's safe and a drug-free option that can really make a difference. And the examples are Osborne Erectile system. The second one is Encore Delix vacuum therapy system and the Vasarect vacuum therapy device. And the last one is Post-Evac Erectec system. And these are typically FDA cleared and are available via prescription or over the counter. And that's wrap up on the today's guide of PDE5 inhibitors and vacuum erection devices. I hope this video helped you better understanding your options for managing the erectile dysfunction. If you found this helpful, don't forget to give it a thumbs up, share it with someone who might benefit, and of course, hit the subscribe button for the more clear evidence-based health content. No fluff, just facts. Got any questions or experience to share? Drop them in the comment below. I'd like to hear from you. Thanks for watching, and I'll see you in the next one. Stay healthy, stay cheesy with Pharmacy Made Easy. Follow for more.